Hi everyone, Eileen Bayer the Fam here. Welcome to another video on factitious disorder. In this video, we are going to cover how common factitious disorder is, what are the signs and symptoms of it, and what is the diagnosis and treatment for this disorder. Excuse me. So saying that, let's get started with this. And you ask yourself, how common is factitious disorder? I don't hear a lot about it. Well, to answer your question, there are no reliable statistics regarding the number of people in the United States who suffer from factitious disorder. Obtaining accurate statistics is difficult because the patients do not typically acknowledge their disorder. In addition, people with fictitious disorders tend to seek treatment at many different healthcare facilities, resulting in statistics that are misleading. It is estimated that about 1% of these admitted to hospitals are believed to have fictitious disorder, but this is likely underreported. Now, as to the cause of fictitious disorder, the exact cause is unknown, but researchers believe that biological and psychological factors do play a role in the development of this disorder. Some theories suggest that a history of abuse or neglect as a child, or a history of frequent illness in themselves or family members that required hospitalization. Let me make sure I'm reading the right thing. Yep. Okay. May be factors in the development of the disorder also. Most patients with fictitious disorder have histories of abuse, trauma, family dysfunction, social isolation, early chronic medical illnesses, or professional experience in healthcare. Example, training in nursing, health aid work, etc. The symptoms of fictitious disorder are these: lying about or mimicking symptoms, hurting themselves to bring on symptoms. After diagnostics tests such as contaminating a urine sample or tampering with the wound to prevent healing. Be willing to undergo painful or risky tests and operations in order to obtain the sympathy and special attention given to people who are truly medically ill. Most people with this disorder do not believe they have factitious disorder. They may not be entirely aware of why they are inducing their own illnesses. Many people with factitious disorder may also suffer from mental disorders, particularly personality or identity disorders. Now, as for the diagnosis and testing for this, due to the behaviors involved, diagnosing factitious disorder is very difficult. In addition, doctors must rule out any possible physical and mental illnesses and often use a variety of diagnostic tests and procedures before considering a diagnosis of fictitious disorder. It's really hard when you have this, it's really hard for doctors to diagnose it. And, one reason is because they go to different ones, and it just makes it so hard because a lot of mental illnesses have a lot of the same conditions and other things, so they really, really have to work, and it's not easy. If the mental care provider finds no physical reason for the symptoms, he or she may refer the person to a psychiatrist or a sociologist. A psychiatrist and a psychologist use thorough history, physical examinations, lab tests, imagery, and psychological testing to evaluate a person for physical and mental conditions. The doctor bases his or her diagnosis on the exclusion of actual physical or mental illness in his or her observation of the patient's attitude and behavior. So, you see, with this factitious disorder, not a lot of cases go on. For one reason is the person does not believe they have it. So it's like they go to a doctor, they're not willingly, they don't willingly go through these tests that the psychiatrist and the psychologist requires. So a lot of them will be like in and out of like mental health hospitals. The worst part though is when it's factitious disorder by proxy, which is where these inflict illnesses or injuries on another person because of this disorder. And they don't leave that person's side. So a lot of times, if it's a child, the child can't say, well, my mommy did this or whoever did it, because they don't leave that person's side. Because they know when they do that in the hospital, the attention goes from the patient, which is the child or whoever it is, that the fictitious disorder has inflicted upon, okay? It goes on that person with the factitious disorder. So it's a very complicated mental illness, and that's why, not a lot of people can report it, because as I said, people with it go through many doctors in many different hospitals and mental health facilities, and they're not always willing to go along with all the tests and everything. So to get an accurate amount of how many people have it, it's really difficult. But, just knowing the different things that we've learned so far, you can know it. Now, don't get this confused with the what we call a hypochondriac, because they're two different things. Okay? A fictitious disorder is not a hypochondriac. I don't want people getting them confused. Tomorrow we will do some more on this. I don't know how many more videos there's going to be. I know it's not going to be as long as the last mini-series on mental health disorders. On epilepsy, excuse me. It's not going to be as long as that, thank God. There should only be a couple more after this. I will let you know as we get closer to the end. Before I let you go, remember to always see with your heart and not your eyes, because what your eyes see is not important, but what your heart truly sees inside is what matters. So remember, guys, your words are a two-edged sword. What comes out of your mouth can either uplift or destroy somebody. Don't be that person that causes somebody to take their life because of something that you consider minor that you said, whether it's about where they are or who they are or whatever. Instead, if you don't, be like my father used to teach me, if you can't say anything nice, if you're in that type of situation, then just don't speak. Because you don't know what that person's going through in their life. You don't know where they've been, anything about them. Unless you can walk a mile in their shoes. Can't say anything. It's best just not to say anything if you can't speak anything nice. Because you don't know if what words come out of your mouth, if they're not uplifting, encouraging, or inspiring, Whatever comes out of your mouth that's negative could be the straw that breaks the camel's back, and could be what causes them to take their life, because it's just piled up. So it's much easier to make sure that doesn't happen and speak of encouraging and inspiring and uplifting to them. Be that voice that lifts them up and lets them know that they are important, that they do matter, because you matter to me. You are important to me. And I love you for who you are. If you need me, reach out. I'm here. And please try and be that way to others. Let them know, like I let you know, that you are important and you matter. Okay, so until tomorrow, bye. Love you. Have a great day, everyone.